As we age, chronic medical problems can send us rushing to the hospital, again and again. Yet we're not ready to quit. We might still have years left. A new approach to medicine, called outpatient palliative care, anticipates these emergencies and tries to prevent them. Marilyn Cronin was too sick to live, but she wasn't ready to die.
I cried and I cried. I was scared and I called Jim up. Even when I went to doctors by myself, I called Jim up. I got COPD, I got emphysema, and all this and that. Or then when I found out my liver was really bad, that I could die, then I cried again. I was scared to death.
She's only 58, but years of smoking and drinking harmed her health. She curled up on the sofa next to a bucket for vomit and cried. Because her liver's failing, her belly fills with fluids. It's uncomfortable, and it squeezes her weak lungs, so breathing gets tough. Deteriorating and hopeless, she thought about giving up. A nursing facility proposed hospice. Her family rejected that choice, but they needed help.
I always felt that was not for her.
Yeah.
Because that's when you're giving up. It's almost like you're just going to lay in bed.
Well, that's what I was going to do. That's what I wanted to do, was just die.
Between her despair and delirium, she dreamed of recovery.
Because of this.
Yeah,
this is pressing. It's like a pregnant woman always wants to pee.
Then they learned about outpatient palliative care. It's not for patients with less than 6 months to live, like hospice. Instead, it's for those with long and lingering major illnesses, sparing them the trauma and expense of repeated hospitalizations. A nurse came to their home and charted a course: medication for her illnesses, help with caregiving, and support for her new sobriety. If she stayed sober, doctors might consider her for a liver transplant. That lifted her spirits. She felt like living again.
Yeah, let's have a listen to your back if you don't mind.
Okay, I'll take this off. I got long sleeves on.
For 4 months, nurse practitioner Karen Gossage has delivered medicines and encouragements.
You can pull my shirt up.
Okay.
Yeah.
You okay?
Yeah.
Emotionally, when I first met her, she was sort of defeated and had resigned herself to dying.
But their consistent visits have helped turn things around.
Okay, good. 120 over 60.
Okay,
It's
120,
very good.
yeah.
Textbook stuff.
Good, yeah.
The more we talked about it, the more I realised that she had given up cigarettes and alcohol, and that if she had the will, that we would do our best for her to give her the best opportunity to reaching that stage where she can be evaluated for a liver transplant.
I feel like she's my doctor. I don't know what it is. I just feel like she's like a friend,
Careful planning and home visits are a type of life support, giving her the encouragement she needs to stay optimistic.
I like having a nurse come and see me. I feel I'm spoiled rotten.
She knows there's no guarantee that she'll get a new liver, but she's feeling better now. When our body weakens, it gets tougher and tougher to make trips to the doctor's office. Palliative care visits can allow us to stay home, a precious gift in our declining years. After several illnesses and injuries, Dr. John Myers lost mobility. After 60 years of medical practice, he now finds himself a helpless patient.
We are here really trying to support you during this period to help with your symptoms.
I appreciate that.
See, the ideal is that we want to be able to keep you home,
Yeah.
as opposed to having you in a facility someplace?
I spent a lot of time in the facility and it didn't do me too much good.
And that was after your surgeries with the...
Yeah.
Palliative care doesn't just help the patient, it helps the caregiver too, because long-term chronic illness is tough on loved ones.
If he had the cancer, he had to have the surgery. He was in focus rehab for a little bit after that. We were only home a week or two.
Hospitals and nursing homes are lonely places to live if you have a long-lasting chronic disease. Susan thinks that he might just give up if he was put in a facility.
Staying home here was just like being blessed compared to being locked up someplace we didn't want to be.
As we age, millions of us may find ourselves facing the same kind of end-of-life treatment decisions as Maryland and John. With more programs like palliative medicine, fewer of us could spend our remaining days in emergency rooms as our graying society copes with the cost of dying.